Imagine you are in a coma of 2 years, then all of a sudden you wake up just for realize that your whole world is going down a pandemic caused by virus. Time to turn back to reality. As a nation, we are affected vigorously by the pandemic. From the multiple MCO and government lockdown, we ourselves are getting more and more helpless during the periods. So today, I will talk about the pandemic in Malaysia. Therefore, we will state the social impact, the economic sense of the pandemic, the role of politics and health of the nation, the COVID-19 vaccine, and what will future look like if this pandemic continues. Too much of anything can be bad, even time spent with those close to you. That is what some families discover during the COVID-19 lockdown. The pandemic forced government around the world to close their borders, shut down the school and business, and restrict people from leaving their homes, unless and necessary. Many social impact that we can know at our country. First is
First is having depression and mental illness. It because the society is very stressed with various internal and external issues such as jobless, school closed, and loss of source of income. This is indirectly contributes to our poor level of health during pandemic. Statistics show that almost 68% of Malaysians suffer from depression every day, and almost every day we can hear of suicide case. And I think if we don't make something, this figure will keep going up until we cannot handle it. Next, second impact is people lost their job. In Malaysia, we can see a lot of people lost job during a COVID pandemic and their family do not have money to buy the necessities. This cause more anxiety and become more stress to continue living. This thing to turn some people to drink drugs and alcohol to help them cope the stress. But it leads to more problem. For example, the people who lost their job maybe start to rob, kidnap and do the negative activities to get the money. Then it is clear that COVID pandemic is very much affecting to us. Third impact is child education. Since school hold most of their class remotely, childcare become a problem for parents who have to go to work. Children themselves feel isolated from their peers and may have trouble coping with the new distant education system. This will cause most children to lose focus when study and not be open-minded when study online during the pandemic.
Effects on the economy, presented by Muhammad Safwan.
Let's begin by saying manufacturing companies are majorly affected by this pandemic. How? The abrupt shortage of inventory and materials from overseas. As we know, most companies in Malaysia itself originates way beyond our reach, as in from Japan, China, or might as well say from the USA or United States of America. These may lead to the halt of import and export during the first glance of the pandemic. As we know, during the first glance of the pandemic, the government has put a halt and barriers towards our borders. This is due to the government initial call for the multiple MCOs and lockdowns. Also, let me add on to that. These manufacturing companies or these factories, or one might say, might be a stirring pot to a high percentage and potential to create a mass population cluster. As we know, these company might just hold hundreds or thousands of staff members at one time. Also, based on research made by Taylor's College, manufacturing commodities such as oil and gas by the global crude oil crisis, which has caused oil prices to plummet this year. That means we are in a major crisis. Next, we'll talk about the hotel and tourism industry. The deficiency in tourists and customers from all around the globe might also hit the hardest for these companies as well. Staff temporary or permanent termination via the borders of the country being closed for the entire period of the order. Right, which is also a huge loss for Malaysia since it was ranked the third most popular Asian travel destination in 2018. This will lower the gross domestic product or GDP as fewer goods and services can be produced. Also, the services by our men themselves produced in the country. Additionally, the increase in unemployment rate due to the retrenchment of employees by some companies will reduce the net income of and thus GDP as well. Now, last but not least, we'll walk you through the retail companies. Why has retail companies have been shutting down most recently in the few years? This is caused by the malls being closed down due to the MCO. These retail companies also has a way to being bankrupt as they have invested a lot of time and a lot of money into these companies themselves. This is also well due of lack of customers throughout the MCO.
The Role of Politics, presented by Muhammad Ikmal.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ikmal Azim bin Nasharuddin, and today I will tell you about 3 important content that I will try to highlight about the role of the politics in ensuring national security during and after the COVID-19 pandemic. My first point is ensuring the country's economy remains stable. First, the spread of COVID-19 that originated in Wuhan, China has resulted in lockdown at the world level and forced all the countries to stop producing, selling or buying goods from each others. Indirectly, this has also resulted in a reduction in income and profits for businesses involved in import or export trade prior to the outbreak. The government has already assisted and controlled the situation well through the announcement of the Prihatin Economic Stimulus Package. For the time being, the Malaysian economy is undergoing adjustment to the COVID-19 situation. This can be seen through the increasing trend of reliance on e-hailing and e-commerce services. My next point is ensure people get vaccines to achieve herd immunity. The daily vaccination rate in Malaysia has surpassed the world average per capita vaccination rate for consistently 250,000 injection doses per day. This gives us an idea of being on the right track in order to achieve group immunity in the near future. To achieve herd immunity, it is necessary for at least 80% of Malaysians to receive vaccines. The governments should urge and ensure all the Malaysians receive vaccine through good campaigns to receive vaccine and block the spread of fake news about the dangers of taking vaccines. And my last point is the third point is empowering healthcare sector. The response to the COVID-19 pandemic is strengthening healthcare system across the Asia Pacific region and around the world. The infrastructure and supply chains of the healthcare providers are being challenged, and our healthcare frontliners work tirelessly to provide a treatment and support in a time of unprecedented demand for patient care. It is crucial to speed up the routine tasks and services, especially during the time when a growing number of patients and limited resources can quickly overwhelm staff. Increased medical needs and state-of-the-art technology facilities to facilitate the hospital dealing with COVID-19 patients. Not only that, frontliners should also be provided with PPE equipment. Not only can this help during the COVID-19 pandemic alone, it is also helps the preparation in the future in the event of an outbreak that is similar or worse than this.
Health of the Nation, presented by Srivani.
We all know that COVID-19 pandemic shook the world in an unexpected way. It's really an immense loss for each country. The most emphasized fragment is the government can't control the circumstances which is happening in own country, so they acknowledge to be generalized lockdown and quarantines. In Malaysia, the government announced movement control order as measure to combat the spread of the COVID-19 in the country. The pandemic turns a person's life like a hell. The most indigest truth is COVID-19 pandemic give a lot of effect towards the health of the nation. The overall cases until now is 817,838 are tested positive and 731,193 are the people who are recovered from the COVID-19, and sadly 5,980 people are died from the COVID-19. As we see, COVID-19 also affects the public health by spreading viruses like a fever, shortness of breath, cough, pulmonary symptoms, and also difficulties in breathing. In additionally, it also affecting the mental health of the nation by giving financial burden which is faced by many citizens in Malaysia. Many small medium enterprises like SME in Malaysia can no longer sustain the financial burden that is brooding and has been resorting to the cutting wages, reduce the number of employees as well as providing unpaid leaves indefinitely due to blooming uncertainty of the country economic status. Losing a job brings a feeling of the insecurity, which is eventually disrupts the mental health, leading to the feeling of anxiety and also depression. The pandemic has been affecting the entire food system in Malaysia. Food crisis rise in Malaysia. For most, no income means no food or less food and also less nutrition food. Many people in Malaysia faced poverty in this period. The study showed about in Malaysia 25 point adult experienced food quantity insufficiency and 25 point percentage of people had food variety insufficiency. 21.9% practice reduced the size of the meal and 15.5% of people skipped the main meal due to lack of money to spend. This is because of food prices are very high. Food becomes a demand for availability during this pandemic situation. Recently, Malaysian about local sources of food mymakan.my are giving a local producer critical bloodline to survive and continue producing more. It's also helped to encourage the local food production in Malaysia. It will survive from the food crisis. In conclusion, the impact of after COVID-19 towards the health of the nations by influencing towards the public health, employment, food crisis, security, labor issues in particularly workers' health, mental health and also safety.
COVID-19 vaccine, presented by Shuwati.
The coronavirus disease 2019, known as COVID-19, turned into a global human tragedy and economic devastation. The coronavirus has reached millions of cases daily in all around the world and caused deaths too. COVID-19 vaccines were evaluated in clinical trials and have been approved because those studies shows that the vaccine significantly reduces the probability of contracting the virus. The possibility of serious complication for anyone who gets the virus, along with the public health consequences of the pandemic's continuing its course, is the strong reasons in favor of getting vaccinated. The vaccine should be compulsory as it would save many lives and it is our most powerful tool to eradicate the coronavirus. Because even though there are certain people might not want it, it must be used to ensure safety for others too. Just because doesn't one person doesn't want it, they should be aware that by not having it, they are putting others in danger. 2. Vaccination is simple, safe and effective way of protecting people from harmful diseases such as COVID-19 and other viruses. Based on what has been approved about vaccines for other diseases, the COVID-19 vaccine may help keep you from getting seriously ill even if you do get the virus. Furthermore, getting vaccinated also may protect people around you, particularly those at greater risk for severe illness from COVID-19. When we get a vaccine, our immune system responds. It recognizes the invading germs such as bacteria and virus. Even though it affects certain groups less seriously than others based on age, health, and other factors, it is still not possible to predict how COVID-19 will affect any individual. Stopping a pandemic requires using all tools we have available. Wearing masks and social distancing help reduce your chance of being exposed to the virus spreading it to others. But these measures are not enough. Vaccine work with your immune system so it will be ready to fight the virus if you are exposed. COVID-19 can bring upon serious life-threatening complications as hospitals are seeing in hundreds of patients daily who need hospitalized care. As the response to the COVID-19 continues, countries must also act now to protect immunization services in their own country in order to further minimize disease outbreaks and loss of lives.
How to avoid COVID-19, presented by Ame Danish.
How to avoid COVID-19? The COVID-19 pandemic has been part of our lives since March 2020. According to CDC, the best way to prevent illness is to avoid being exposed to the virus. Here's the steps that you can take to prevent the spread of COVID-19 and protect yourself and others. First is by wearing a mask. Wear a mask in crowded outdoor settings and for activities with close contact with others who are not fully vaccinated. Make sure you are wearing a mask that have 3-layer fabric mask. The outer layer that is made from hydrophobic material, the middle layer that's act as a filter, and the inner layer that is made from hydrophilic material. Next is cleaning your hands often. You need to clean your hands with soap and water, especially when you have been in a public place or after blowing your nose, sneezing, or coughing. Or you can use hand sanitizer or alcohol-based hand rub that contain at least 60% alcohol. We need to make this as a routine for us to wash our hands often. Furthermore is getting vaccinated. We need to make sure that the vaccine is authorized by the government to protect us from the COVID-19. As soon as you're able to get the vaccine, please get it immediately to avoid spread and the effect of COVID-19. With this, you are able to do more things. For example, to do more outdoor activities, but you still need to follow the SOP when needed. Lastly is stay 6 feet away from others. With this, you need to avoid close contact. While you are indoors, you need to stay 6 feet away from your family members and the people who are sick. While you are outdoors, you need to also stay away from others, and especially the people who have high risk of getting sick.
Okay, my friends, that's all from us. Take care. See you next time. Thank you.